Vitamin D is a fat-soluble vitamin that is naturally present in a limited number of foods, but is available as a dietary supplement. It is also produced in the body when the sun's ultraviolet rays shine on the skin and vitamin D synthesis occurs. In foods and supplements, vitamin D is available in two main forms, vitamin D2 and vitamin D3, both of which are well absorbed in the small intestine. Simultaneous presence of fat in the intestine increases the absorption of vitamin D. Features of vitamin D: helps better absorption of calcium in the stomach, helps build bones, cell growth regulator, reduces inflammation, helps with nerve and muscle function, strengthens the immune system, helps to metabolize glucose, helps treat high blood pressure and high cholesterol, helps prevent MS, reduce eye damage, relieve muscle spasm, improves diabetes, reduce the process of weight gain, reduce the risk of uterine fibroids, reduce the risk of Alzheimer's, reduce colorectal cancer. Sources of vitamin D intake: meat of fatty fish such as salmon, tuna, fish liver oil, cheese, egg, mushrooms. Exposure to sunlight. D2 and D3 dietary supplements: spinach, walnut, olive oil, caviar, cow liver. Complications of vitamin D deficiency: osteoporosis, bone pain, muscle weakness and pain, fatigue, mood swings such as depression, hair loss, sweating too much, digestive problems, recurrent infections. Who is at risk for vitamin D deficiency? Infants, elderly, people who are less exposed to sunlight, people with dark skin, patients with impaired fat absorption, fat people. Warning: extremely high levels of vitamin D in the blood, more than 150 nanograms per milliliter, can cause nausea, vomiting, muscle weakness, dizziness, pain, loss of appetite, dehydration, increased urination, excessive thirst and kidney stones. Extremely high levels of vitamin D can also lead to kidney failure, irregular heartbeat and even death. High levels of vitamin D almost always occur due to overdose of vitamin D supplements, because our skin limits the amount of vitamin D absorbed. Golden tips. Studies show that a lack of vitamin D in the body causes weight gain. Vitamin D helps the body store fat later. 1 tablespoon of natural peanut butter greatly increases the absorption of vitamin D. For better absorption of vitamin D, some fat is needed. To get enough vitamin D, you need about 5 to 15 minutes of sun exposure on your face, arms, legs and lower back 2 to 3 times a week. Excessive sun exposure can lead to complications such as skin cancer and aging. Have premature skin.